Good morning, everyone. Thank you for joining us for the Ministry of Health virtual media conference on the national COVID 19 response for December 8th, 2021. Our panelists today are Dr. Rushan Parasram, Chief Medical Officer, Ministry of Health, Dr. Alana Best, County Medical Officer of Health, County St. Andrew, St. David. And we also have Mr. Roshan Siram Singh, Manager Geographic Information Systems, Epidemiology Division. I am Al Alexander, Senior Corporate Communications Officer in the Ministry of Health, and I will moderate this morning's media conference. We begin with the latest clinical and vaccination updates by Dr. Parasram.
Hi, good morning. Thank you, Al. Good morning to Dr. Best. Good morning to Mr. Siram Singh, members of the media, members of the viewing and listening public. So I'll begin with the COVID-19 update for the 7th of December 2021. Total persons tested so far at both public and private facilities, 459,629. Over the last 24 hours, we would have recorded 666 new positive cases, taking our total positive cases since March 12, 2020 to present to 76,601. Our total recovered patients are 61,396. Our total active positive cases now at 12,902, with our home isolation patients at 11,576. And Dr. Best will be going into some detail as to how we can care for ourselves when we are at home. In terms of hospital, 512 persons at the hospitals, 148 at our step-down facilities, and 97 in quarantine sites across the country. In terms of our vaccination figures, total persons vaccinated with the first dose of a two-dose regime, 650,160. Those completed vaccination, second dose of a two-dose, 605,081. Total persons vaccinated under a single-dose regime, the Johnson & Johnson, 44,969. And those persons completed a vaccination regime, combined 650,050, which is approximately 46% of the population. Total persons with an additional primary dose at this time, 34,178. If I could have the first slide of my short presentation on an update on the Omicron variant, please. Yeah, so the update on the Omicron variant of concern B11529, courtesy the WHO's weekly epidemiological update on COVID-19 published on December 7, 2021. Next slide. So, as of the update, if you can go forward, please. Yeah, thank you. As of December 5th, Omicron has been confirmed in 57 countries, all 6 WHO regions, Europe, Americas, Western Pacific, Southeast Asia, Eastern Mediterranean, and Africa. In South Africa itself, there has been a 111% increase in new cases between November 29th and December 5th. 62,021 new cases in all. Next slide. So we have also noticed a very large increase in new weekly cases in the countries originally detected, in neighboring countries, for example, Eswatini, Zimbabwe, Mozambique, Namibia, and Lesotho. In terms of descending order of increases, 1,990%, 1,361, 1,207, 681, 219. Just to note, these countries have very low vaccination coverages, and it gives you an idea, anecdotally at least, at the speed of spread and transmission of this particular variant. Next slide. So the next slide will tell you in South Africa itself, we have coverage of 25.2% of South Africa's population is fully vaccinated at this point. Preliminary data suggests that Omicron mutations may reduce the neutralizing activity of antibodies, resulting in reduced protection from natural immunity. And this basically means for people who have been infected, not for people that have been vaccinated, at least at this point in time, you're seeing being prone to an increased risk of infection, what we call secondary attack in the early data coming out. Data is still being tabulated as to the severity of disease coming out of those countries, together with its effect on vaccine efficacy. Some early data last night as well suggesting that in South Africa itself, you're seeing an increased incidence of persons presenting in the lower age groups early 20s and below to their facilities. Thank you all for the few minutes this morning.
Thank you very much, CMO. We will now go to Dr. Alana Best, who will provide us with a guide to home isolation for COVID-19 positive patients. Dr. Best?
Good morning, Dr. Parasram, Mr. Siram Singh, Mr. Alexander, members of the media, and members of the viewing and listening public. Thank you for inviting me to talk with you today. One of the worrying things that we are seeing in this current surge is the increasing number of persons who are significantly unwell and require hospitalization. So this morning we will cover some simple reminders of how to isolate and quarantine at home and when to call the ambulance. We will also briefly look at the duration of quarantine periods. So, if we go to the first slide, please. Thank you. Next. Just as a reminder, there are varying symptoms of COVID-19, from respiratory symptoms like cough, runny nose, nasal congestion, or sore throat. You can have the gastrointestinal system affected. People may complain of nausea or vomiting. There may be diarrhea. And more generalized symptoms can include fever or chills, fatigue, muscle or body aches, headache, and then we have new loss of sense of taste and or smell. We do have to remember, of course, that someone can be completely asymptomatic and yet still COVID positive. Next slide. So if you have any of these symptoms, you are advised to go to your nearest health facility to be tested. You will then be issued with a quarantine order and be advised to quarantine or isolate at home. It's important that you do stay at home. Do not go to school, work, the grocery, or any other public area while you are on quarantine. You should separate yourself from others in your home where possible, and do not invite persons to come to your home. Wear a mask when you are around other members of your household, and you should make arrangements to have your food and medication and other supplies delivered to you, and where possible, use separate facilities. If you can have a separate toilet and bath, please make use of that. Next slide. For persons who are living with somebody who has been diagnosed with COVID or who is symptomatic, ideally you should be sleeping in separate bedrooms. If not possible, then separate beds, and try and sanitize the area as often as possible. We would advise that you open your windows to improve ventilation where possible. Do not share towels, cutlery, glasses, etc. Again, use different bathrooms, and if you do have to share, then you must sanitize before it's used by someone else. All members of the household, if somebody is under quarantine or isolation, should be wearing a mask as much as possible. And ideally, if you do have more vulnerable persons, so an older relative or somebody who has underlying chronic conditions, you do want to try and stay away from them as much as possible while you are quarantining at home. So let's say you have symptoms, you have received a positive test. Next slide. It's vitally important that both you as a positive case and your household members are aware of the warning signs that you may be getting into trouble and need to call 811 for urgent medical attention. If you are having problems completing a sentence because you're so short of breath, if you are noticing that you have a persistent pain or pressure in your chest, there's a heaviness on your chest that is not dissipating. If you notice that your loved one is confused when they are normally not, that is also a warning sign. If there's altered consciousness, so there's an inability to wake or stay awake. And then depending on the the usual skin tone of a person, if you notice that they're looking paler or they seem to be looking a bit gray, or there's a bluish color around the skin, lips, or nail beds, then these are all indicators that urgent medical attention should be requested by calling 811. one of the things that we want to avoid is persons who are being monitored on a daily basis having these problems, say, overnight, and they're waiting until the next day for the county team to call to check in on them. If you experience any of these warning signs, please go ahead and call 811 for yourself directly. We do not want there to be a delay in you having the necessary medical intervention. Next. So let's switch gears and talk about the quarantine period. When most persons present to a health facility to be swabbed, they are typically issued with a 14-day quarantine period. If, for instance, they were a primary contact of a positive case and they themselves go through that 14-day period without any symptoms developing, at the end of that period, they are safe to return to work. If, however, they are swabbed and that test comes back as being positive, they will receive an extension of that quarantine order. And the length of the overall quarantine period depends on the clinical status of the person. Next slide. So for persons who are symptomatic, there's a minimum of 20 days that they will be required to quarantine. We need them to have 10 clear days of being symptom-free before they can be released from the period of quarantine. For someone who has tested positive and never had any symptoms, their standard quarantine period is a 17-day period. Next slide. And that 17-day period is calculated from the date of their positive swab result. So the next slide simply summarizes these two criteria in terms of how we deal with symptomatic versus asymptomatic persons. And in closing, I would just like to once again thank all our healthcare workers, and in particular our community healthcare workers who continue to do their best to support patients in home isolation. And I'd also like to say thank you to our partners at the ambulance service, GMRTT, who make every effort to provide prompt care when called upon. Thank you. Back to you, Al.
Thank you, Dr. Best. I now hand you over to Mr. Roshan Siram Singh to present the latest Geographic Information Systems report.
Thank you.
Morning, yes.
Thank you very much. CMO, Dr. Best, Mr. Alexander, members of the media, and members of the listening and viewing audience, good morning. For a number of weeks, we have been recording continuous increases in the number of cases nationally. At first, the increases were a bit gradual. However, more recently, these increases became more significant and notable. Today's GIS presentation takes a look at the spread of these cases across the country. So as we go to the first slide, we take a look at our point map, which represents the period epidemiological weeks 45 and 46, which in terms of dates cover the period the 7th to the 20th of November. Generally, what we see is a continuation of the pattern, the spatial patterns which we've noted for some time, and that is the preference of cases in the more populated areas and along major road networks where settlement is taking place. So we see, for example, from Diego Martin in St. George West all the way to Arima in St. George East. And we see coming south, first we look at Central, we see what is taking place in County Caroni and then County Victoria, where we have a large number of cases being recorded. To better understand this data, we take a look at our second map, which is our Coroplet map, which looks at the data for the same period, epidemiological weeks 45 and 46, aggregated at the community level. We know that the majority of communities across the country have recorded at least one case, with many communities, as we can see, recording a large number of cases. 28 communities recorded over 50 cases, and these communities are spread across several counties. 7 of these 28 communities are in St. George East, 6 are in Victoria, 5 are in County Caroni, 4 in County St. George Central, 3 in County St. George West, 2 in St. Andrew St. David, and 1 in County St. Patrick. So again, we note that these communities which have recorded a high number of cases are spread across the entire country, which is indicative of the widespread nature of the situation and the cases at this moment. To look at the data aggregated at the county level, we switch to our chart, and we note several things. We note, firstly, counties Carney, Victoria, and St. George East continue to record the highest number of cases. We also note that all 9 counties, recorded continuous increases over the period epidemiological weeks 43 to 46. So this is from the 17th of October to the 20th of November. However, Nariva Mayaro continues to record the lowest number of cases among all counties in the country. We switch now to our space-time trend analysis map. And this map gives us an indication of which communities across the country have been recording increases, as we see in red, or decreases, colored in blue, or those communities which did not have any significant trend that was identifiable. Just to spend some time on this particular map, 134 communities were identified as uptrend communities. And within these communities, we had 4,611 cases mapped. That was out of a total of just over 10,000 cases mapped for the period, epidemiological weeks 43 to 46. So about 45% of the cases mapped for that period were cases mapped in uptrend areas. As we switch now to our map of County Carney, I'll just spend some time breaking down the data. The number of communities identified as uptrend communities in County Carney was 32. And the number of persons, the number of cases within these communities totaled 1,016 cases. As we switch to County Victoria, 24 communities were identified as uptrend communities, with 602 cases being recorded within these 24 communities. And as we look finally at County St. George East, 20 communities were identified as uptrend communities, with 1,051 cases mapped within these 20 communities for the period epidemiological weeks 43 to 46. And that is County St. George East, which is the next map. Yeah. So just to put these numbers into context, we know the number of cases in County Carney, County St. George East, and County Victoria continue to be high, but we must also understand this in the context of the population. These 3 counties are also the 3 counties with the highest population among all counties in the country. So just to put that into context. Before I close, I just wish to take the opportunity to remind everyone to please avail yourself of the opportunity to take the vaccine. Please as well continue to follow the measures as required. Please continue to wash your hands, watch your distances, and wear your mask. Thank you very much.
And thank you, Roshan. We move to the question and answer segment, and we ask the media representatives to state their name and the name of the media house before posing your 2 questions. In the first instance, of course, on which we will field an additional question once time permits. Please note that we will start with azpnews.com.
Good morning, Al, and good morning, everyone. Prabhi Hari, azpnews.com. My first question is the CMO, and the second one is for Dr. Best. CMO, I just wanted to get your take on how we are now giving a second and third dose of the vaccine to women who had first taken a Sinopharm and then she got pregnant. And then she's allowed 2 doses of the Pfizer. Is that WHO approved? And a lot of people are saying too that who have gotten a Pfizer who had gotten a Sinopharm would like to take another vaccine. Would that be allowed under the Ministry of Health? And my second question for Dr. Best. Dr. Best, the whole issue of the quarantine. AZP News, we have had a lot of queries about someone who is placed in quarantine. He gets his order, and after the time has expired, his employer wants another document for him to be allowed to work. Can you clear that up? And also, is it that he has to take another test to confirm that he's negative?
Prior, we'll go with the two questions, and then you'll give us the follow-up question after. Thank you so much.
So thanks, Prior. So as you know, the only two combinations that are WHO approved at this time and that we utilize is AstraZeneca followed by Pfizer and AstraZeneca followed by Moderna. As you know, we don't have Moderna in the country at this point in time. So the only acceptable combination so far, until there's some change, is AstraZeneca followed by Pfizer, which we do use in Trinidad. Dr. Bess.
Thank you very much. Dr. Bess?
Thank you for the question. With regards to positive persons, at the end of their quarantine, they do not require repeat testing. That is not part of our current protocol. We're going based on the trend of their symptoms. At the end of the quarantine, well, let's go back to why we quarantine. We quarantine so as to reduce the likelihood of a positive person passing on the virus to family or co-workers. The minimum periods that we have can be extended based on how the person progresses. And at the end of that period, so at the end of the date covered by the quarantine order, we expect that that person is now safe to reintegrate back into society. So there is no current need for us to issue a document. However, if in exceptional circumstances the employer does require it, we can try to facilitate, bearing in mind that we are in the midst of the largest surge that we have, and our staffing constraints are significant.
Thank you very much, Dr. Bess. We now go to TTT.
Good morning, everyone. Kimberly D'Souza, TTT News. My two questions are for Dr. Parasram. Dr. Parasram, I'm not sure if you saw an article where the Singapore government, they're advising their population, at least those who have taken the Sinopharm vaccine, to get that third booster shot before December 31st so that they can maintain their fully vaccinated status by January 1st. I know that the ministry has plans to launch a booster program for the adult population. Do you know if the ministry is also going to advise the local population here, those who have gotten the Sinopharm, to get that additional dose so they can maintain their fully vaccinated status? And one more question for you, Doctor. We had a question coming in from a member of the public. They're asking about, with respect to roadside public consumption for vendors, is that allowed? Thank you.
Okay, so thank you. In terms of the Sinopharm question, as you know, the primary additional dose for Sinopharm for all of those over 60, as well as the immunocompromised, was launched quite a short while ago in Trinidad and Tobago. So we haven't changed the definition of what a fully vaccinated person is, for the fact that we need to give them some time before you can have that third shot. And then we can look at recategorizing the definition of a fully vaccinated person who fall within that category of needing an additional primary dose. Related to your second question, is it consumption of food you're speaking of, or something else? Just to get some clarification. From TGT? Okay. I just need the clarification before I can answer. So maybe when she comes back on, we can clarify that second bit.
Right, so we will come back
to
TTT. So we move to Newsday. Newsday, we are ready for your two questions.
Good morning, everyone. Rihanna McKenzie here from Newsday. My first question, we're seeing obviously a rise in cases in teens and children, and in some cases babies. There also seems to be the same trend that where increases in cases in children are happening in the United States with the Delta variant. So I'm just wondering, will the ministry refocus its on its highlighting these rising cases in teens and prevention for children specifically? My second question. Why didn't the ministry allow people who wanted a third dose of the AstraZeneca vaccine to get it rather than get rid of the remaining doses that expired? And what is the WHO recommendation there for AstraZeneca boosters? Thank you.
Okay, so generally you can't, in terms of dealing with a childhood population, I think we have focused quite a lot, and we had Dr. Joanne Paul on and a number of pediatricians onto this press conference and other media platforms to highlight what we were seeing in terms of increased rates of infection amongst the children, and of course the sequelae of hospitalization and even deaths. You can't take a child in isolation in terms of what we can do at a population level, aside from highlighting what is happening. We need to view the population as a whole, and we want everyone who can be vaccinated, and we were saying that from the start, that there are a group of people, for now, anybody under 12, can't be vaccinated, and we require the rest of the population to be vaccinated to protect them and form a herd around that group of people. So we're asking everyone, not only people within that group, or persons who have children within that group, to abide by the public health guidelines as best as you can, and to vaccinate as quickly as you can to protect that vulnerable group that we have in the population. Your second question, if you could just repeat the last part of your second question, please. I got the first part. As Newsday, can you repeat the last part, please? Okay, so I'll answer the part that I got. So in terms of the boosters, what you're asking about is the use of AstraZeneca as a third dose. So we have authorized for primary additional doses the use of AstraZeneca as a third dose in immunocompromised people, and persons have been getting it up to the point it was expiring. We have stood always on the back of the recommendations following WHO for technical reasons related to safety and efficacy, and we continue to do so as it relates to that part of the vaccination program. So Al, that's the bit I got.
Thank you very much. CMO, we go to TV6 for your two questions.
Good morning to everyone on the panel. Cindy Raghuba, Tika Singh, TV6. My two questions. I know in the past that when contact tracing was done for positive cases, data would have been provided. The suggested activities that might have led to certain increases, and now that we're seeing such a spike currently, is the data showing a correlation between certain types of activities and the high number of cases right now? And the second question, given that Omicron is now seen in 57 countries, so much greater than initially thought when the ban was in place, is it the advice of the medical professionals locally that we should maybe extend the ban in any way, given the large number of countries now having cases? Thank you.
Yeah, so in terms of your contact tracing, generally speaking, what Mr. Sriram Singh and even Dr. Best would have alluded to in their presentations is there's widespread community transmission of Delta across the country. It is often difficult to pinpoint a particular source where when there's clustering of diseases, when we're at the stage of cluster spread, it is a little easier to say you have a cluster from one activity or the other. At a population level, what we do notice all the time is then when there's an increased gathering of persons in terms of an increased movement of people, together with non-adherence of the public health guidelines, you tend to find that there's an increase in the number of cases subsequently about 2 or 3 weeks thereafter. So generally speaking, that is the trends that we continue to see. The second question, I'll just remind me.
Extension of the ban.
Right. So in terms of restrictions, again, that is under the purview of the Ministry of National Security and the Cabinet of the country. As the Honourable Minister would have said, we continue to look at the data coming out of different countries. You have to bear in mind that the majority of cases of this particular variant so far is being highlighted in that particular area of South Africa and the African southern region. So we continue to keep an eye on it, and of course we will provide recommendations going forward.
Thank you very much. CMO, we go to the Express for your two questions.
Good morning, Kimbo Drum from the Express. Maybe the CMO would take these. Can you tell us?
Just speak a little louder, please. We are having some challenges hearing.
Oh, okay. Sorry. Is this better?
Yes.
Yeah. Okay. Sorry. CMO, maybe you would take this. Can you tell us what reactive means in a COVID-19 antibody test? And is a reactive reading the basis for a general practitioner to refuse to see a patient? Also, I know we have ventilated this much, but can we revisit the flu shot and COVID-19 booster shots? Plus, well, you would have gotten your vaccine before, so there's some concerns from people as to should I still get my flu shot, especially after a booster shot, etc. Thank you.
Sure. So reactive generally means that you detect something from an antibody test. When you say the word reactive on the test, it generally means that it's detected. Sometimes it's a qualitative test rather than a quantitative test, so they use the word reactive in that particular type. So if you're seeing reactive, it probably means that it's positive. By way of the flu shot, and thanks for the question, I have been getting some questions from the healthcare providers as well. So if you do have a flu shot, you wait 2 weeks and then you can have your COVID vaccine, and vice versa. If you have your COVID vaccine, you wait 2 weeks and then you could have your flu shot. So that's the time frame that we have on our records in terms of our vaccine protocol.
Thank you very much, CMO. We go to AZP for his follow-up question. Prior, good morning.
Yes, morning again. Yeah, CMO, I was asking about the woman who had taken a Sinopharm and gets pregnant. Now the ministry is allowing her to take two Pfizer shots.
Sure.
So I want to know if that is not approved by WHO, why is the ministry allowing it?
So that is a what you call is an exceptional circumstance. So you have somebody that would have had one dose, and then of course becoming pregnant. The only dose that you can have thereafter is Pfizer, of course. So it's an exceptional circumstance where we consider almost like the Sinopharm is a restart of your vaccination program based on her pregnancy state. And of course, we're urging all pregnant women to be vaccinated as quickly as you can as well, because it is considered a high-risk state for COVID-19. So the benefits outweigh the risk, and we know that the Pfizer followed by the Pfizer is an acceptable combination, and it is the only choice that that individual would have had to protect her and her baby during that time. So it is a benefit versus risk analysis, and it was an exceptional circumstance. And if we have other cases like that, the clinicians will make the decision based on the circumstance.
Thank you for your question, Prior. And we go to TTT for the follow-up question.
Hi, Dr. Parasram. Just to confirm, so the question was with respect to roadside public consumption of food and drinks by vendors. Is this allowed now? Thanks.
Food and drinks. Yes, roadside vendors. Yes.
Okay, so let us have a little. I think we'll come back to you on that. But I mean, in terms of the public health guidelines, I have to defer to the legal minds and to give an answer to that question. But generally speaking, we are asking as best as you can to keep your mask on as much as possible. So even if you do buy roadside food, that you consume it in privacy and have your mask on. When you pull your mask down, you're putting yourself and others at risk. So from a public health perspective, we would like that, of course, you consume that elsewhere rather than congregating without masks in public.
Thank you very much, CMO. We go to the Newsday for the follow-up. Yeah, that person's follow-up question.
Good morning again. My follow-up question is from a member of the public. Actually, this person is in Canada and would like to
just
come
speak
to
a little
Trinidad.
louder, please. We're having some challenges hearing. Just speak a little louder. Thank you.
Okay, sure. My question is coming from a member of the public who is currently in Canada and would like to attend a funeral here in Trinidad. And the person is saying they took a mix of Pfizer and Moderna, which is not recognized here, or so they're being told. And she would like to know if she takes a Pfizer booster, will she be allowed entry into the country without having to quarantine?
Yes, so if you have either Pfizer or Moderna, which means that you meet the requirement for Trinidad and Tobago in terms of our entry requirement of having either 2 Pfizer or 2 Moderna, then the quarantine period would not be necessary at that point. Of course, once you have a negative PCR 72 hours before entry as well.
Thank you very much, CMO. We go back to azp.com for a follow-up question.
Yes, morning again. CMO, I just wanted to understand again about this issue of women pregnant women Pfizer, but didn't the WHO also approve the Sinopharm for pregnant women, but we are only giving them for breastfeeding. Is that the case? And why not within?
Currently, the National Immunization Tag considered the recommendation from WHO, and they thought, based on a number of factors that they can, looking at technical data that they got, that we thought it wise to use the Pfizer for that particular group, and we took that decision a couple months ago. So that was coming out of a decision from the National Tag Group.
Okay, thank you very much. Ladies and gentlemen, we have come to the end of today's media conference. It was quite a short one. Today we spoke about home isolation for COVID-19 positive individuals. Science looks for to know that there has been some deterioration or improvements. We got a GIS update and addressed a number of important questions posed by the media, and we want to thank the media for those questions. Remember that we must all work together to reduce the spread of this COVID-19 virus. We can all do our part by making the responsible decision to follow the health guidelines. Let's get back to the fundamentals, such as wearing your mask properly, washing your hands properly, social distancing properly, and of course, please get vaccinated. Goodbye for now.
And I took the COVID vaccine. Very grateful to be having it. I am 76 and I love being outside, interacting with people. This gives me some extra confidence to do that, especially as I'm diabetic and hypertensive. So I feel free now to do all the things that I love to do, simply because I am able to take the vaccine.
Don't delay. Get vaccinated today. A message from the Ministry of Health.
Developing a vaccine is a long road full of checkpoints. Different phases of testing are designed to make sure it is both effective and safe. But with the whole world struggling to contain a pandemic and unprecedented amounts of scientific work taking place, the road to finding the COVID-19 vaccine looks more like this. But first, let's take a look at the usual path. During preclinical trials, the vaccine is tested on animals to determine whether they develop antibodies to the